One of the biggest problems in America right now is the opioid epidemic. Here's a scenario that starts off seemingly harmless. A person that had a serious injury or undergoes a major surgery or has cancer is prescribed a medication to treat the pain, and the medication is usually codeine, Vicodin, morphine, and oxycodone, all of which are opioid narcotic pain relievers. The problem is, these drugs can cause physical dependence. This means that a person relies on the drug to prevent withdrawal symptoms. Over time, more of the drug is needed for the same effect. This is called drug tolerance. But more recently, opioids are being overprescribed for backaches and other less severe health conditions. The pharmaceutical companies are giving large incentives to doctors to prescribe these medications, which has turned into overprescribing and is the biggest cause of the epidemic. The DSM-5 lists the criteria for opioid use disorder as having 2 of 11 symptoms occurring within a 12-month period. Having 2 to 3 symptoms is mild, 4 to 5 is moderate, and having 6 or more symptoms is severe. It takes a very short time to become addicted to opioids, but having an opioid disorder is more difficult of a beast to deal with. The level of physical dependence makes it difficult for a user to stop due to the severe withdrawal symptoms like chills, cramping, anxiety, nausea, vomiting, and diarrhea, which makes it extremely difficult to stop using the addictive substance. That is why we have MAT. MAT stands for Medication-Assisted Treatment, which is medications in combination with counseling and behavioral therapies to provide an effective, well-rounded approach to the treatment of opioid use disorders. A common misconception associated with MAT is that it substitutes one drug for another. Some people believe abstinence is the only way to get clean, but if there are any ways to help in the epidemic of opioid use, misuse, and overdose, why not offer that chance to everyone in need? MAT has many benefits. First and foremost, it reduces the cravings and withdrawals. It also decreases crimes that addicts engage in to supply their habit. It also lowers the risk of relapse and overdose and minimizes the spread of HIV and Hep C among IV users. There are a few medications used as maintenance for opioid use disorder. They are all opioid antagonists, which means they reduce cravings and withdrawal symptoms. First, there is methadone, which has been used for years. Then buprenorphine, which is safer and can be as effective as methadone if given an adequate dosage. It can be taken as a tablet, sublingual film, or a 6-month subdermal implant, or a once-a-month injection. Then there is Suboxone film, which is a combination of buprenorphine and naloxone. Another medication is naltrexone, which is an injectable medication that lasts for weeks and can eliminate the barrier of daily dosing for patients. Treatment begins with assessment at a clinic and starts with a supervised dosage and progressively into unsupervised. Medi-Cal and private insurance will cover a certain amount of these medications. For some patients, they would titrate down in dosage, and some may stay on it for years. Ideally, a patient would get their medications from a clinic and also attend a treatment program for the behavioral part of the overall treatment plan. I will end with this cold, hard statistic. 95%, yes, 95% of people who quit cold turkey without medicated-assisted treatment will be back on heroin within 5 years. 60% with medicated-assisted treatment will more likely be abstinent after 5 years. Thank you for listening to my presentation.